Hi, y'all. So, 5 reasons to not have a home birth in America. 5 reasons to not have a home birth in America. I'm Dr. Fatu Forna. I am an OBGYN who works to keep pregnant women safe here in the US and around the world. I've wanted to do this discussion. Black women, there are many benefits of home birth. I get it. You're less likely to have a C-section and other interventions. You're comfortable in your own home. It's less stressful. You have choice. You have autonomy. You're going to have your birth plan. I get it. Many countries actually do this very, very, very well. They do home birth well. About 20% of all births in the Netherlands are home births. Netherlands does it really well. Kudos to them. There's a province called Ontario in Canada. Ontario, am I pronouncing it right? 20% of them, of their deliveries are also home birth. They do it well. Studies have shown in countries like this, it is safer for women to deliver at home, actually, over the hospital, or similar, very similar safety. And it's because of the things that they put in place. They have very good risk selection. They make sure that only the low-risk women are delivering at home. Women without hypertension, diabetes. They make sure that it's women with their second or third baby, that come out quickly and easily. Most importantly, their home deliveries are integrated in their obstetric care system. That's what they do. That's what they expect to do. They have good transport system. It's easy to get to the hospital. And they're supervised by very well-trained midwives who know what to do and know to transfer at the hint of a problem. In Canada, for example, those home deliveries, about 25 to 45% of them are transferred to the hospital, because the minute they see something funny or squirrely, you're going straight to the hospital because we're going to keep you safe. So that's how they approach home deliveries. At the hint of a complication, you're gone to the hospital. So when you have all of those things, you do it well. That's what the Netherlands does. That's what places in Canada do. I'm going to tell you 5 reasons why we don't do that in the US and why it's not a good idea. Number 1, maternal mortality. The US is a whole different story. We are not Canada. We're not the Netherlands. We're different. They have low maternal mortality. We have high maternal mortality. So maternal mortality alone, that difference is why we don't do home deliveries well, or we shouldn't be doing them here. Number 2, racism. Racism is a big issue. These are white women in these countries. We are black women. I'm talking to you, black women. Not everything is for us. Repeat after me. Home births in the United States of America is not for black women, all right? Home births are for low-risk women. There are many things that happen to black women in the US that makes us high risk. You can go back and look at some of those previous videos that I've made. A lot of times, black women have high risk conditions that put them at risk for delivering at home. So that, taking you to number 3, those high risk conditions. As black women, we're more likely to have obesity, hypertension, diabetes, postpartum hemorrhage, preeclampsia. All of those things that when they happen to moms, they're at risk of death and you need treatment within minutes to save your life. We're not doing that at home. You don't have that access at home. So having a baby at home puts you at really high risk of dying, because you have those high risk conditions. Number 4, and this is a big one, it's the US system. Our US system is not set up for home births. And because of this, less than 1% of all births in the US are home births. It's less than 1%. Don't be fooled by what you see on social media. It is very, very rare. And it's very, very rare because when it happens, moms die and babies die. Why are we not set up? Let me back up. We're not ready right now. We might be ready 20 years from now, 30, 50 years from now, maybe, but right now we're not set up. And the reasons we're not set up, Home births are not a part of the delivery system. They're not integrated into obstetric care. When people do home births, they're outside of the system. A lot of times it's with a lay midwife who doesn't have hospital privileges. If there's a complication, there's no way to get someone quickly to the hospital. It's not set up. So not integrated with the obstetric care system. The transport system has problems. So a lot of times when you have a complications, you're bleeding heavily, the baby's not breathing, you need treatment within 1 to 5 minutes. Think about that. I live in Atlanta. Atlanta traffic, I can't hardly get out of my neighborhood within 5 minutes. So the transport system is not set up well, as it is in the other countries. They have a system of transport to get you quickly to the hospital. We have unregulated midwives. We have something called certified nurse midwives, CNMs, who are wonderful. I work with them. I've worked with them all my life. A lot of the CNMs deliver in the hospital. They know what to do. They're well-trained like midwives all over the world. Very few of them do deliveries at home. A lot of the midwives that do deliveries at home are lay midwives. Sometimes they have a name, certified public midwives. A lot of them don't have any formal medical training. They might have a high school diploma, and they are certified to do deliveries in multiple states. So no regulation. You don't know what you're getting. You just think I have a midwife. You don't realize that it's a midwife who might not have a medical education. A lot of these midwives also that deliver at home might not be attached to a hospital, might not have admitting privileges, might, if they've done something shady and have a bad outcome, they're reluctant to transfer you. And who's going to be in trouble? Who's going to die? You. So those are the reasons why our system is not set up. Number 5, your baby is more likely to die if you deliver at home. There have been multiple studies showing that home births are more dangerous for babies compared with hospital births. In Oregon, for example, they looked at their data and found that babies that delivered at home were 7 times more likely to die. 7 times. So other studies have shown that too. When babies come out, many times they come out, they need resuscitation. Who's going to resuscitate them? Who knows what they're doing? I need my pediatricians there to help. If you have a shoulder dystocia where the baby is stuck, what are you going to do? That baby is more likely to die. So there are lots and lots of issues there. So you are more likely to die if you deliver at home. There's no access to emergency services, C-section that you might need to save your life or the baby's life, blood transfusion, medications to stop your hemorrhage or devices that can stop bleeding like that, seizure drugs, life support. When shit hits the fan during labor, it goes from 0 to 2,000 in seconds, and you need access to these life-saving procedures for you and baby. Child, y'all don't raise my blood pressure. Actually, I raise my own blood pressure. But, this is something I'm very passionate about. It's very dangerous. Black women, home birth is not for you. Because we need you to survive. We need you to survive and thrive here in the U.S. All right? All right. Y'all take care.